I'm Gracie, your RN. I'm here to talk with you about Discharge. Who do you have with you here today?
So my name is Claire. I'm Natalie's sister.
And my name is Maya. I am Natalie's roommate.
Awesome. I'll hand you your discharge paperwork. And I brought some folks with me today.
Hi, I'm Blessed, and I'm going to be your med nurse.
Hi Maya, and I'm Ashley. I'll be your social worker today.
Natalie, how are you feeling today?
Honestly, I'm fine. Just ready to go home. I've got a lot weighing on me there.
That's great to hear. We want to make sure that you're fully prepared before you leave, and it won't take long.
She keeps saying she's fine, but I just want to make sure everything's covered.
Absolutely. And that's why we've got the whole team here to make sure that you, Maya, and Claire all know what to expect.
All right, Natalie, let's go over the medications you're going to be going home with and what you need to know about each one. All of these are prescribed based on your heart condition or your bipolar disorder. So we'll start with the aspirin. You'll take 81 milligrams once daily. This keeps your blood thin and prevents clots from forming in your stents. You might notice some mild stomach upset or easy bruising, but that's normal. Take it with your food and call your provider if you ever have black stools or unusual bleeding. Next is the clopidogrel, 75 milligrams once daily. It works with the aspirin to keep your stents open. You'll take it at the same time every day. Don't stop with your cardiologist approval, since missing doses can increase your risk for another heart attack. You'll also be on atorvastatin, 40 milligram at bedtime. This helps lower your cholesterol and prevent plaque buildup. Common side effects can include mild muscle aches, but if you ever have severe muscle pain or dark urine, call your provider right away. So how am I doing? Do you have any questions?
So far, no.
Okay. All right, so your next one is the metoprolol, 25 milligrams twice daily. So that helps lower your blood pressure and heart rate, protecting your heart from overworking. Make sure to check your pulse before taking it. If it's below 60, hold the dose and call your provider. It can make you feel tired at first, but that usually improves. Your losartan, 25 milligrams once daily. This helps you lower your blood pressure and protects your kidneys, especially important with your heart condition and lithium use. Take it at the same time each day. Let your provider know if you feel dizzy. And your nitroglycerin, 0.4 milligram tablet. So that one you're gonna take as needed only. This is not something you take every day. It is only used for chest pain. And with chest pain, with the nitroglycerin, you sit down, you take one tablet under your tongue, wait 5 minutes. You may repeat up to 3 doses. If the chest pain continues after the second dose, call 911. Finally, for your bipolar disorder, you continue lithium carbonate, 300 milligrams twice daily. This keeps your mood stable and prevents manic or depressive episodes. You will need regular blood work to check your lithium level, kidney, and thyroid function. Make sure you stay hydrated. Drink 6 to 8 cups of water a day and avoid big changes in salt intake. Call your provider if you notice tremors, confusion, vomiting, or unsteady walking, since those can be signs of lithium toxicity.
That's a lot, but I think I can manage.
You're doing great. To help, we've added a pill organizer and phone reminders so you can take everything at the right time. Your home health nurse would also check in every Monday, Wednesdays, and Friday to make sure you're staying on track and not having any side effects.
I can remind her too. We'll make it part of her routine.
Perfect. Little routine goes a long way.
I can check in every night too, just to make sure she took everything.
That's amazing support. She's lucky to have both of you.
So let's talk about food next. You'll be following a heart-healthy diet, so it's going to be low in saturated fat and sodium and high in fiber. So think fruits, vegetables, whole grains, and lean proteins like chicken or fish.
I usually don't cook much. I just kind of grab something quick.
That's That's fine. We've listed some easy, heart healthy on the go options for you, like Greek yogurt, tuna packets, chicken wraps, and fruit. We just want to make sure you avoid fried or salty foods, and then also limiting caffeine and energy drinks since they can raise your heart rate and worsen your mania. And then once you're feeling more settled, maybe you and Maya can meal prep together once a week. Things like grilled chicken, brown rice, roasted vegetables are simple and quick. That way you'll have heart healthy meals even on the busier days.
Yeah, we can do that on Sunday too.
That's perfect. And maybe try pairing your meals with your medication times. Think food plus pills equals health.
I can help too. We can make easy meals at my place all the time.
That's wonderful. Pairing your meals with medication times helps a lot with consistency. Since your stents were placed through your wrist, you want to make sure you're not lifting over 10 pounds for about a week. You want to avoid bending or twisting the wrist too much. You can walk around the house as you feel up for it, and short walks can be great. After a week, and once your cardiologist clears you, you can increase to about 30 minutes of light walking most days. I would avoid any strenuous activity or heavy lifting for 2 to 4 weeks, and again, avoiding caffeine and energy drinks. And then for chest pain, you can use the nitroglycerin that Blessing talked about earlier.
We'll make sure she doesn't overdo it.
Yeah, I'll keep the heavy stuff off her plate at home.
So does that mean I can go back to work soon?
You can probably resume light duty after about a week, but no stocking any heavy boxes until your cardiologist clears it. You're also enrolled in a cardiac rehab 3 times a week, and so they'll help you exercise safely and monitor your heart while you're doing it. You can also resume sexual activity after a week unless you're having any chest pain or shortness of breath. And then just remember, if you are having chest pain that doesn't go away after 2 nitroglycerin tablets, or you have any bleeding or sudden shortness of breath, to call 911 right away.
Natalie, since you've mentioned challenges staying consistent with your mood and medications, your team arranged for a short inpatient psychiatric stabilization stay before you return home fully.
Psych. I don't need that. I feel fine.
You do look great, and this is just a proactive step, not a punishment. It helps your psychiatric team review your medications and make sure your mood stays stable as your body recovers. It's a few days at most, and you'll transition home safely. When you're discharged, you'll get started in outpatient therapy through Monarch Behavioral Health and have access to the NAMI support groups.
That sounds helpful. She does better when there's structure.
We want you steady when you come home. Exactly. Structure helps maintain stability. After that, you'll attend outpatient therapy with Monarch and the NAMI support systems. We also looked at your support system and what's available once you're home. Your main social determinant of health and focus is social and community contacts, making sure you have strong relationships and accessible resources. You live with Maya, which gives you a good social support, and your sister Claire will help with check-ins. Now, I want to ask each of you directly. Maya, are you able to help her with medication reminders, rides, and emotional support?
Yes, absolutely. We live together. I can check in with her daily, help with meds, meals, everything she needs.
Okay. And Claire, you serve as part of her support system for the first few weeks?
Of course, I'll call her every night and make sure to take her to appointments on my days off.
That's exactly the kind of support she needs. You'll have an at-home health nurse visiting Monday, Wednesdays, and Fridays, covered by your insurance. The nurse will check your vital signs, the risk site, ensure medication compliance for both cardiac and bipolar medications, help with reminder setups and refill scheduling. She'll also coordinate with outpatient providers and confirm that you make your appointments for the cardiac rehab sessions. Other community supports include transportation assistance through Go Wake Access and Medicare non-emergency transport, medication cost support from NC Medisys and GoodRx, cardiac rehab for safe exercise and recovery. Our goal is to make sure you have consistent follow-up and don't feel like you're alone in everything.
That actually sounds good. I like that someone's coming by. I get kind of off track when things are hectic.
Exactly. The home health nurse will help you stay steady and connected to your care team. You're not alone. We're building a whole safety net around you.
All right, Natalie, before you head out, let's do one last quick review to make sure that everything's clear.
Okay.
Can you tell me why it's important you take your aspirin and Plavix every day?
They keep my stents open and prevent clots.
That's great. And then what about the atorvastatin?
That one lowers my cholesterol and protects my arteries.
Perfect. And what about metoprolol?
That one lowers my blood pressure and slows my heart rate so that my heart doesn't have to work too hard.
That's great. And then can you tell me about your lithium? What do you need to remember with that medication?
I should take it at the same time every day consistently, drink lots of water, and call if I feel shaky or confused.
Excellent. Now, what kind of foods should you be focusing on at home?
It should be a heart-healthy diet like chicken wraps, yogurt, fruits and veggies, and me and Maya will meal prep on Sundays so that I have easy meals for the week.
It's a perfect plan. And then are there any drinks that you should avoid?
I should avoid energy drinks and too much caffeine because they can make my heart race and affect my mood.
Perfect. And then what about your activity level right now? What's safe for you when you leave the hospital?
Short walks, no heavy lifting for a week, and I can slowly increase once my doctor clears me, and I will go to cardiac rehab 3 times a week.
Exactly. Now, what will you do if you have chest pain that isn't going away after you take 2 of the nitroglycerin tablets?
I should call 911 and I shouldn't drive myself.
Absolutely. And then who's going to be checking in on you after discharge?
A home health nurse will come Monday, Wednesday, and Friday, and she'll check my vitals, help me with my medicines, and make sure I get to all of my appointments.
Perfect. And then who's supporting you at home?
Maya and Claire.
And what supports do you have for your mental health?
I will be at a short inpatient psych facility, and then I'll do outpatient therapy with non-arc and NAMI.
Perfect. That structure will help you stay balanced.
I feel like you've really got it, Natalie. Is there anything else that you're unsure about?
No, I think I've got this. I'm ready to go home.
Yes, we'll keep her on track.
She won't be doing this alone.
Sounds like a great support team. I think you're ready for discharge, Natalie, safely and confidently.